In honor of opening day, I am super pumped to be bringing you guys the first of many upcoming baseball videos. And yes, I am a Cardinals fan, so you know I've got to be rocking that gear for the first game of the season. While there's many injuries that can occur in baseball, of course one of the most specific injuries to this sport is whenever players have an elbow injury to their ulnar collateral ligament requiring Tommy John surgery. There's a lot of different directions we can go with this injury that I plan on covering over the upcoming season as indicated. We can talk about the types of surgeries, we can talk about risk factors, training to prevent it, recovery, so on and so on, but a lot of that's kind of useless without just some baseline understanding of what this is, the anatomy of the elbow. But I want this video to serve as sort of the primer for all those future ones, so we're going to talk today about the basic anatomy of the elbow, the ulnar or medial collateral ligament of the elbow, why it gets damaged in throwers and can lead to Tommy John surgery, and then just briefly touch on some other highlights like risk factors. As always, hit that subscribe button if you guys like these and want to stay up to date throughout the rest of baseball season, and let's get started. Let's pull up our elbow anatomy to take a look at the key structures here. So the upper arm bone is our humerus, and then the two bones in the forearm are the ulna and the radius. The big bump that you can feel on the back of your elbow is the olecranon process, and that's part of the ulna. And then your radius goes down and is on the side of your thumb, and your ulna is on the side of your pinky. There's lots of different structures that insert and originate around the elbow that aren't really relevant to this one, so we're gonna focus specifically on the inner portion of the elbow. In anatomical terms, we would classify this as the medial part of the elbow or the inside of the elbow. And let's go right off the bat to highlight the ulnar collateral ligament, or sometimes you'll hear it called the MCL or the medial collateral ligament. This ligament runs from the medial epicondyle of the humerus down onto the ulna. And you can feel the medial epicondyle of your humerus yourself. If you kind of go where about your funny bone is, it's that sharp little prominence that is right there at your elbow. That's part of your humerus or your arm bone. And just beyond that, just up closer to your arm is right where that ulnar collateral ligament originates, and then it runs down and inserts on the ulna. One thing you might not have known about the anatomy of this ligament is that there's actually three components to the UCL. The one that's most often injured is that anterior bundle. And that makes sense if we think about the direction that it's running. So if you imagine this picture and the elbow is a little bit straighter, you can think how that band of that anterior bundle is going to be running more in line with the bones, and so it's directly carrying that load of preventing that elbow from bending outward. The two other bundles don't have as much of that biomechanical load that they're carrying, and so the anterior bundle is something you can drop with your friends as being that most common bundle of the UCL that gets torn. That ligament is the primary stabilizer to valgus stress in the elbow. So what's valgus mean? So valgus and varus imply two different directions of bending in our joints. Specifically with the elbow, a valgus stress is going to be anything that causes that ligament to be stretched and that medial portion of the elbow to open up. On the other hand, a varus stress is going to be the opposite direction and stress the ligaments on the outside of the elbow. Why this matters so much for baseball players is because whenever you go to throw, that motion where your arm is cocked backwards before you get ready for that acceleration phase, you're putting a ton of load on that UCL, because what you're essentially trying to do is bend your elbow backwards, and bending your elbow backwards puts that valgus load across that ligament. The amounts of insane torque and stress that are generated from throwing a fastball 90 miles an hour are well beyond what the body was really designed to be able to handle, and so we're putting a lot of load on that ligament. There's surrounding muscles in that same area that also help to stabilize that part of the elbow, specifically two called the FCU, or the flexor carpi ulnaris, and then the flexor digitorum superficialis. Those are both muscles that flex your wrist, but because they originate up on the arm, they run really close to that UCL ligament and provide some additional stability along with that ligament. Important to know, in this same anatomical area is where we have our ulnar nerve, and it runs in that little space where you can consider it to be your funny bone. That's that location on the back of your elbow that when you hit it on the corner of the table, you get that shock down your arm. That's because you're hitting this ulnar nerve. We'll do a video at some point along the way this season talking about ulnar nerve injuries in throwers, because that can also be an injury because of that stress and that torque at the elbow. So how common is this? It's estimated around 16% of pitchers have had this surgery at some point in their career. The reason it's so concerning and the subject of so much research is that over the recent part of this turn of the century, there's been almost a tenfold increase in the number of these injuries and subsequent surgeries. We'll do a whole separate video on risk factors, but we know that the number one risk factor for this injury is pitch velocity. That makes sense. The harder you're putting torque on your elbow in that throwing phase to swing forward, the more you're stressing and straining that ligament. And so the faster you're throwing, the more stress you're putting that ligament under. Also, increased player weight has been shown to be a risk factor, as well as someone who is younger. We've all heard about the classic kind of arm blowout, and certainly that can happen where it's just one sudden throw where that ligament just ruptures, but it's also possible to have kind of chronic, more long-term building up of damage where ultimately it just gets more and more torn and then gets to the point where it goes out completely. What do we do to treat it? So if it's not completely torn, if it's not all that painful, we can do a conservative period of roughly 6 weeks where you completely rest the elbow, prevent it from going into any of that torquing valgus motion, and then you gradually return to your sport and your activities. A lot of times, as we know though, when it's injured, it's completely torn to the point where it requires surgery, especially in an elite athlete who's throwing. What are the doctors gonna do to test to see if someone has had this injury? Well, usually the player has pain during the acceleration phase of pitching, or the phase where their arm has already been cocked and they're accelerating the ball forward. That's the phase of throwing where you have the most load on that ligament, and so that's where you typically have pain. If someone's got damage to the structures in the backside of the elbow, they more often have pain on the deceleration or the follow-through phase whenever their arm is trying to slow down that motion to stop. Of course, you can have pain, you can have swelling in that area of the ligament, but then what the doctors will do is a test to see how much that joint opens up by applying a valgus load and testing the integrity of that ligament. We do this with the arm flexed a little bit because that provides the optimal position for those fibers, and it's even more specific and sensitive to actually test that bending and opening as you're moving the elbow through the full range of flexion and extension. So if conservative management isn't an option, then of course we have surgery, and that's where this Tommy John surgery comes from. So it was named after the first player who actually had this done. His name was Tommy John, and he was a pitcher, and this was done in the 1970s. There's been a lot of different surgical techniques that have evolved over the years because we learn more and more about how to optimize the healing and prevent damage to the other important structures in the elbow. That's another thing we'll cover in a future video, talking about the different types of surgeries they can do and how they repair that ligament. But we know from past experience that this is about a 1-year loss of time when someone has this done. You've got to be really careful that you give it plenty of time to heal and don't allow those fibers to tear up after repairing it. And so often it's around 4 months before athletes will even be able to start throwing again after the surgery. It is reassuring that around 80% of pitchers who have this done in the major leagues do return to playing, but only roughly 2/3 return to their previous activity level before the injury. So I hope this helped to establish some kind of baseline knowledge of what this injury is, what those structures look like in the elbow, how they can be injured when a pitcher is throwing, and then we'll expand on this topic a lot more throughout the year as we run into more of these injuries and have more time to talk about things like risk factors, prevention, surgery, and so on. As always, leave any comments below. I'm sure all the Cubs fans are gonna let me know how much they hate this shirt, but that's okay. Ask any questions. I love interacting with you guys about different topics you wanna see me discuss or questions you have about this one. And until next time, thanks for watching, and we'll see you all later. Bye.